Capitol this morning, live, where the president is set to hold a signing ceremony later this morning to approve another $500 billion in coronavirus spending, much of it going to struggling small businesses. This comes as the president appears to contradict even his own health experts when it comes to a possible treatment for coronavirus. Tracy Potts has the latest.
With unemployment hitting a record 26 million in the last month, today President Trump signs a $484 billion coronavirus stimulus, adding billions for small businesses to pay their workers.
All of it in interest of job retention and first and foremost to address the key issue of health.
The science of COVID-19 landing President Trump in the spotlight again, suggesting sunlight and ingesting disinfectants may kill the virus.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and then I see the disinfectant where it knocks it out in a minute, 1 minute, and is there a way we can do something like that by injection inside?
We don't do that within that lab, our lab.
His own experts refuting that disinfectants and heat,
I've not seen heat or light,
I think it's a great
that work on surfaces are safe or effective for humans.
It was incoherent, filled with misinformation and misstatements from one end to the other.
Seeking solutions as Georgia and other states begin to reopen today.
It puts all of our communities at risk.
While others lock down, Illinois is extending its stay-home order another month. And President Trump is now suggesting that social distancing guidelines may be extended past May 1st. Tracy Potts, NBC News.
Washington's congressional district making sure that the new stimulus package benefits actually help Washington employees. We spoke with Representative Susan DelBene, who says she is excited to see more help for small businesses.
Important that we set aside money to make sure some of our smallest businesses, our businesses in rural areas, can go to local community banks, can go to work with the bankers that they worked with in the past, and we set aside resources so that those folks would be able to make those loans.
Representative DelBene says this new round of funding includes $60 billion. She says that was left out of the first round of funding. Mimi.
Experts say small business owners need to act fast to get pay protection cash. But even when some of these businesses are facing challenges, even if they've been approved for the loan. King 5's Kira Fallon is live in Covington to tell us exactly why they're facing this hurdle. Kira?
Yeah, well, a lot of these small businesses have had to make a lot of changes. So some of these small businesses are closed altogether, and then there are places like restaurants who no longer do sit-in dining but have to do things like DoorDash and to-go orders and delivery. Well, because of this, they've had to cut a lot of their staff, and so some of these small business owners are now worried that they're not going to be able to meet the requirements of the Paycheck Protection Program. So take Ethan Stoll for an example. He is a Seattle chef and he owns 17 restaurants. He applied for and got money from the Paycheck Protection Program, but the thing is, he says 75% of that money has to go to payroll so the loan will be forgiven. But since he's had to cut a lot of staff, he just doesn't see how that's possible.
You know, we would love to have the restrictions opened up a little bit so we can, pay our, our utilities, which go to the city, our sales tax that go to the city, can pay our landlords, which we care about deeply because they're good partners of ours.
Other businesses are dealing with similar challenges. According to CNBC, a woman who owns 2 spas, one in Woodinville and one in Bothell, received 2 paycheck protection loans, one for each business. When she tried rehiring workers she had to furlough to meet the conditions of the loan, she said some of her employees were put in a difficult position between getting unemployment and the long-term health of the business. So when she spoke to us, she said the loan conflicted with the unemployment subsidy. So at this point, a lot of small business owners are worried because even though they've got that money from the loan, they're not sure they're going to be able to meet those requirements and get that loan forgiveness. So a lot of these small business owners are really just hoping they make some changes when it comes to the Paycheck Protection Program. I'm live here in Covington, Kira L. Fallon, King 5 News.
Thank you, Kira. Some businesses in Georgia will reopen their doors today. Many have been closed for more than a month because of the coronavirus pandemic. But not everyone agrees it is time to get back to work. Jay Gray is live in a suburb of Atlanta with the story. Jay, good morning.
Hey, good morning, Mimi. We're inside the Train Gym right now. It's one of the businesses that will reopen. And listen, they're anxious to get back to work. Say they'll follow social distancing, also helping that they can help some of their clients ease the weight of what's been a very difficult outbreak.
Scrubbing, reorganizing, and scrambling to try and...
We're going to have a sign on every other piece of cardio equipment.
Outrun the coronavirus. Businesses across Georgia preparing to reopen today.
It's going to be a new normal, basically.
Governor Brian Kemp allowing some hands-on businesses like gyms, spas, hair and nail salons to open, followed by restaurants and movie theaters Monday.
This is a decision that was made based on the data and the science that we're seeing and the gateway that we have into the phase one of the president's plan.
But even the president is questioning the move.
And I want the state to open, but I wasn't happy with Brian Kemp. I will tell you that right now.
Many business owners aren't happy either and say they won't open their doors.
No one feels safe. No one feels that it's the adequate thing to do.
What they do know is the infection numbers are still growing across the state. One model indicating they will peak late next week. Numbers that could keep customers away.
It's risky. You could open at a loss. Everything that we decide has a much bigger impact in the trickling down.
Even for a lot of struggling business owners right now, taking in cash just doesn't make sense.
Yeah, and another thing that doesn't make sense to a lot of people right now is while businesses are able to reopen, the governor's stay-at-home order doesn't expire until the end of this month, Mimi.
For us near Atlanta. Thank you, Jay. New this morning, America's only permanent base in Africa is now under a public health emergency. Coronavirus cases in the base's host country, Djibouti, are nearing 1,000. The U.S. military declared the emergency as a precautionary measure. The public health emergency declaration means any facility can be repurposed for virus response teams. Health workers can be supplemented with volunteers. More than 4,000 U.S. personnel are currently based there.
Mimi, the Kittitas County Incident Management Team is now requesting everyone wear cloth masks in public to prevent the spread of the virus. It's even suggesting the public wear cloth masks until a vaccine is developed to stop the spread. And nursing homes in the Seattle area now proactively working to stop the spread of the coronavirus. They've been working, of course, to prevent it in their facility, but now teams from UW Medicine conducting testing of all residents and staff at several nursing facilities. They're even testing at sites where there were no positive COVID-19 cases. Health officials say this is key to quickly identifying and containing cases, hopefully stopping an outbreak dead in its tracks. Kaiser Permanente is expanding its coronavirus vaccine trial nationally, and that could include older patients as well. Researchers are including older adults to help them understand vaccination outcomes among older people who are at greater risk of contracting COVID-19. They're also expanding the Seattle study to include teams in Maryland and Georgia to better understand how the virus affects different regions. According to Kaiser Permanente, the development of a vaccine typically takes up to 18 months.